Hi everyone, my name is Mike Brown. I'm the clinic director at Team Rehab in Woodridge, right on the border of kind of 75th and Lamont, right by the Kohl's and the movie theater there. This is my clinic. We've been here for a few years now. Excited to be partnering with Downer South this year. I'd like to kind of show you some of the things we offer.
And you offer some pretty interesting things that you're not going to see in other rehab clinics.
Yeah, so one of the things we like to pride ourselves on is patient experience and staying up on top of a lot of the technology and things in the rehab world to provide for athletes, but also for the weekend warriors and the grandpas and grandmas and everyone else too, because they deserve the good stuff too. So we have things like blood flow restriction, dry needling, and stuff that is going to be seen in pro trainer rooms, just like we have them available here.
And you do take lots of insurance.
We do. We take Blue Cross. We take United Healthcare, most Medicare. Most of the big ones. The only one that we don't take would be Cigna. But most of the other ones we're going to be in network with. If you ever have a question, feel free to call, and we'll always kind of verify everything ahead of time to make sure that you have an idea of the cost before you sign up for anything anyway, so that way you're not getting a bill in the mail and surprised by what it is.
I think it's great for parents to know that they have many options, and of course, sports injuries are inevitable, especially in a sport like football. So they have choices on where they can go and seek treatment. And one of the really cool things about you is that you are a former football player.
Yep, played 4 years high school. We have a tech who played high school and in college. So we've been in it. We know the grind of football and skill positions and line drills and things like that, and also the passion behind it. And I usually I get the drive to kind of get back onto the field sooner, because that's where the kids want to be.
I think it's great that you have that experience with the students, and they know that you know what it's like and what you're going through and know the different positions. So what position did you play in high school?
So I moved around a little bit. I started as more the skill position, wide receiver DB, and as I got bigger, I kind of gravitated a little bit more towards the line. So my senior year, I was playing defensive end, little tight end, so I kind of got a little bit of a taste of everything, really, except for linebacker or something like that, or center. But a little bit of taste of some line work and some skill position stuff as well.
Let's look at and talk about some of the really cool things that you have that you would see in a professional level training room.
Absolutely. So for trigger to point dry needling, we're using very small, very thin needles, something very kind of small like that, that you would see with acupuncture, things like that might be a bit more common. What we're trying to do is find the trigger points, which are the top band in the muscles that are sore or painful when you push on them. And those are going to be causing dysfunction in the muscle, either locally in terms of pain or reduced strength or more tension, it's tighter, or they can be referring pain somewhere else. And the goal with the needle is to, without a better way of putting it, is just stick the needle into the trigger point, and when the sharp needle hits the trigger point, you feel a twitch. You might be able to see some twitches. And that twitch is the muscle releasing. So in a way, it's an aggressive way to try to release trigger points. It allows me to get deeper into a muscle than I would be able to from the surface. For people who have had kind of a pain for a long time and never had dry needling, it could be an option that could really hit a spot that maybe they've otherwise not had done before.
And we are doing this on a football player who did play in college. So
I'm gonna
has some experience with the pain.
You can just tricep right here. The needles are sterile, so I have gloves on. I get rid of the needles after that. And really what I'm trying to get is a couple of twitches. So I'm going to come in, all right, and come here. And we're just going to do is tricep. So tap, and right away you see twitching right here. Let's see if I get a big one. Yeah, so we're getting some twitches right away there. And essentially I'm going to go until I feel the twitching stop, because then we'll have kind of cleared that area out, and then I would just kind of move on to the next part. So that's probably good there. And that's just it. So it's very quick. A lot of patients ask if it's painful. It's probably not gonna be your favorite part of the day, but you can see it's quick, and if you're getting that relief that you haven't had in a while, it's a nice option. So this is an example of the blood flow restriction training. So we have the cuff on Miles' arm. We do one limb at a time, obviously. And what this does is personalizing it. So it is going to measure your blood pressure and base everything based off of your individual pressure. So it's not something that is just a generic number that we use. And then you can see as he goes, it's trying to keep everything relatively even. So again, it's a little bit safer. But the point of the blood flow restriction is to cut some, not all, blood flow off to a limb while you're doing an exercise. That allows for, when we're talking about strengthening, you have to be able to create enough of a load to get a strengthening response. So if you have an injured tissue, the American College of Sports Medicine recommends 60-80% of your 1 rep max to build muscle in that tissue. Obviously, if you just strained your calf while you were running, you're probably not going to be able to put 60-80% of your 1 rep max load onto that injured muscle. If you artificially cut some blood flow off to the area, then it creates, it almost tricks the body into a very similar response with only needing 10-20% of the load, which sometimes is even just body weight. So this is how some of the athletes, some of the guys in the NFL are coming back sooner from things like ACL injuries and stuff like that, because it allows them to start building that muscle much faster while it's earlier in the stages of healing, rather than having to wait for all the healing to occur before they start putting a lot more load on, simply because the artificial blood flow being cut off, creating the anaerobic environment needed for strengthening, is not, the amount of weight you're doing with that is so low that you're not actually putting a lot of stress on the tissue that's healing.
So this is great for any kind of injury.
Anyone who needs to build strength in, tendonitis, post-surgical. I've done it on people with knee replacements. I've done it on people with ACLs. I've done it on tennis elbow. I've done it on, a variety of stuff. So anything that, where Achilles tendonitis is a good one, because that can be a stubborn one. Anything where you're really trying to build strength.
Miles looks like he's getting a little.
You can see he's a big dude and he's starting to struggle with even just 5 pounds. So it makes a big difference. And then after all this stuff's done, we deflate and all the blood comes back. So it's very safe. When we're lifting heavy, your body normally cuts blood flow off the area just because your muscles are contracting so hard. This just kind of does it artificially, so you get a similar response with a light load, so you're not irritating a tissue that's injured.
Okay, so you can really see how hard his muscle are working, and it's 5 pounds. He's literally only curling 5 pounds. But because of the way the machine works and helps, he is able to really effectively get some work out there.
Without putting a lot of stress on the actual tissue itself. So the last thing that's going to be a little bit different that we have here is called the Rehab table. So it is a magnet. So if you've ever had an MRI, it sounds very similar. They're both magnets. This one, instead of trying to find imaging, is more trying to do neuromuscular stim. So all you do is lay on it, and the magnet's just on a little track here, so we can kind of work up and down a whole muscle if we want to, or just put it in a spot and just set it. And as it fires, you can see it's going to fire his muscle. So we have it kind of centered underneath his calf. You can see his foot contracting here, and it's just doing it for him. So him as the patient, all he has to do is just lay on it. Doesn't have to take any clothes off or anything. He could have his pant leg down. We're just doing this so you can see it. And as it fires, it'll fire the muscle. So for anyone who, again, right after surgery, having trouble with activating a muscle in knee surgery, getting the quad firing is so important early on. That's usually the first thing they're doing after an ACL or a big surgery, a knee replacement, anything like that. Or somebody who just has had weakness in an area and has been struggling with stability in a leg or an arm or something like that, and it's just something that building strength has been difficult for him. Obviously, the first step is just being able to fire the muscle, and this will help with that and kind of get it going. And it's very adjustable, so we can turn it up or down, so it's not uncomfortable for the patient. It's just a matter of kind of a bit of a strange feeling to have something firing your muscle involuntarily. But
Miles, what does it feel like to you?
It feels a lot like it sounds like someone inside my leg hitting the muscle, making it contract.
Yeah.
You can feel it all the way down into your foot.
But it doesn't hurt. It just...
No, it's kind of nice actually.
So, and the nice thing with it being on a track is we can just set it pretty much anywhere in the body, and it's very adaptable. So we like using this especially early on in patients, but we use it kind of whatever we feel we need to, if a muscle just needs to kind of be woken up a little bit. So, thanks for checking out the space and what we have to offer, and hope for a good season for Downer South. And if you guys, hopefully everyone stays healthy, but if needed, we're here if you need it.
Thank you very much. And this is a really cool facility. And a lot of people don't know that you're here, and you've been here for how many years?
This will be a third year.
And you're a brand new dad too. So another football player in the making.
Probably a future football player, yeah.
Well, congratulations. And again, thank you for partnering with us. And thank you for showing our athletes and the parents all that you offer and how you can help get them quickly back onto the field.
Absolutely. If you ever have questions, feel free to just give the clinic a call too.
And what phone number should they call?
630-991-2454.
All right. Thank you very much.
Yeah, absolutely.